Hello, and thank you for joining me again today on the Finding Hope After Loss podcast. Don't forget to subscribe so you don't miss any future episodes. If you like the show, please leave a review or rating on Apple or Spotify. It only takes a moment and really helps the show reach more loss and infertility families. Don't forget to order your white pumpkin apparel in honor of October being Pregnancy and Infant Loss Awareness Month. Check it out on bonfire.com/white-pumpkin160/ or check the post on social media. I also have several other things going on for the month of October, so you can always check out what's going on again on my social media at Journey for Jasmine, or stay tuned to future episodes for more information. Today I am talking with Sydney. She talks about going through the neonatal loss of her daughter Eden a few hours after she was born due to a rare condition. Sydney talks about all the treatments and care she went through trying to give her daughter the best chance at survival. Hello everyone, today I am here with Sydney. Sydney, can you tell us a little bit about yourself?
Sure. Hi, I'm 27. I currently live in Kansas City. I have a husband, his name is Michael, a stepdaughter who is 7, and then obviously my baby in heaven that I'll be talking about today. I also have 2 dogs, Emmy and Lola, and they're my fur babies. I love them so much. And then I work in insurance. I have my degree in psychology, but life just kind of took me a different route.
What kind of dogs do you have?
They're little. They're both mixes. She's really ugly. She's so cute because she's so ugly. Um, she's like Shih Tzu, Terrier, Chihuahua mix. She's got an underbite.
Oh,
That's
I love the
Lola.
underbites.
Oh, I know it's so, and her underbite is so straight. Like it's straighter than my teeth, and I had braces for 3 years. I've had her for 7 years now, through college and everything. So she's great. And then my other one, she's a Dachshund Papillon. She's very, very pretty. And she's the quirkiest, weirdest dog I've ever met in my life. She's a COVID puppy too. We got her, when we were home for COVID. So she doesn't like being alone.
Do they get along pretty well though?
Yeah, they do. It took a little bit. But I knew we had to get a puppy for her to get along with Lola because Lola's very territorial, so she needed someone she could teach.
And like boss around.
Yep. But yeah, they snuggle a lot. It's super cute.
So do you mind talking a little bit about your lost journey?
Yes. So it was about a year ago now, that I found out I was pregnant. I'd just been feeling really sick and I took a test. We weren't trying or anything. I wanted a baby for forever, so it was a huge blessing, but we weren't trying. So when I took the test, I guessed I was about 3 weeks because it was right after I missed my period. So at what I thought was about 7 weeks along, we went ahead and did a sneak peek test, did a gender reveal, found out we were having a girl. Um, which I know those are super unreliable now, but at the time I didn't, and it was reliable in our case. She did end up being a girl. Um, so about 4-ish days after that, I had my first appointment because they wanted to wait till I was about 8 weeks along. And so I went in, and the sonographer was like, "Well, I know you're not that far along, but let's just see what we can see on your abdomen before we do the internal ultrasound." And so she put it on my abdomen, and immediately I saw the outline of a baby, and I knew I had to be further along than I thought. And so I found out that instead of being 7 weeks and 5 days, I was 11 weeks and 1 day, which is
Wow.
super exciting.
You got to
Super,
skip some of the stressful early weeks.
yeah. And I was super sick for, I mean, it probably didn't go away till after 13 weeks, but I was super excited because I'm sitting here looking at, okay, I've got another like 6 weeks before this subsides. And then I found out that I was 11 weeks, and I was like, oh my gosh, I'm almost done with the first trimester. Like maybe the sickness will stop. I ended up losing actually 14 pounds. I didn't vomit. I don't like to vomit. So um, I just ate crackers mostly and ended up losing 14 pounds from it. It's crazy. So um, we went ahead with that appointment. I met with the nurse practitioner, and because I already have some risk factors for myself, I have some congenital heart defects I had corrected when I was a baby, but um, still we check in on it every few years just to make sure everything still looks good. And then I also had a gastric sleeve surgery about 6 years ago now. So because of that, with like malabsorption issues that can occur from that, I was already considered like high risk. So I already had to go see a high risk doctor. But at that first ultrasound, they saw that her bladder just looked a little bit prominent on the screen. So they said, let's just go ahead and get you in as soon as possible to a high risk doctor, see if that's anything. Different times, different parts of the body are prominent. So it's probably nothing. Um, so the very next week, I went ahead into that appointment, and I didn't think much of it at the time. The sonographer, as she was doing the scan, was very chatty. Um, so I was like, okay, like this must be good. Um, After the sonogram, they took me into an exam room, and I waited for about 15 minutes. And then after about that 15 minutes, one of the nurses came in, and she took me into a different room with a conference table, a TV screen, different infographics on the table, and a box of tissues. Um, so I pretty much knew from there that I was moved to the bad news room, as I call it. And so then what seemed like forever after that, which was really probably only about 30 minutes, but it was the longest 30 minutes ever. Um, the doctor came in, and he pretty bluntly told me that there appeared to be a blockage known as a lower urinary tract obstruction, or it's commonly referred to as LUTO. He explained to me that LUTO causes the baby's bladder to retain urine, so therefore it causes strain on the kidneys. It can make the kidneys not function properly. And additionally, which I didn't know before all this happened, but after 16 weeks, when the kidneys start to take it over and function, amniotic fluid is created by urine from the baby. So with a blockage there, there's no way to create amniotic fluid. Um, so he explained that if my baby was a boy, the condition was likely due to a valve in the urethra. I think it's known as posterior urethral valve, or PUV. Could be wrong on that, because I didn't really go too into detail on that since she was a girl. Um, he said that this is a condition that can be remedied fairly easily in a boy. I've since found out that's not correctly, or not correct information, um, but that's how he phrased it. And then he told me that if it was a girl, it was a much more grim diagnosis. So I better hope that the sneak peek was wrong and that it is a boy. So then he sent me to get the NIPT test done to determine if it was a boy or girl, and also to test for the signs of trisomy 13, 18, or 21, because sometimes LUTO can be um, connected to that. So those tests came back, showed she was a girl, didn't show any signs of any of the trisomies. So we scheduled next appointment for 16 weeks because nothing could really be done until then, anyways. So then at that appointment, my mom and I went to that one. And immediately, like, they put her on the screen, and I could see how huge her bladder was. Um, the sonographer was really nice. It was telling me, it looks like her heart's beating strong. Like, usually with such a bad condition of this, their hearts aren't beating as strongly. She's trying to give me hope. She's very kind. Um, the doctor walked in. He wanted to do just like a quick sonogram himself. So he walked in and put it on my abdomen and said, "This is bad," and walked out of the room. And then I didn't
Oh
see
my
him again
gosh.
for like 30 minutes, which that's just not what you want to hear from a doctor,
What a bedside manner.
right? He didn't really have a great bedside manner, um, as I came to find out. So I know people who've seen him and have had a great experience, but a lot of those people didn't have any bad news that happened. So, I guess it's kind of just based on each of our experiences, I guess. But so after a little bit, he came back in and told me he was putting in a referral for me to go to a hospital in Texas. The hospital up here in Kansas City, they no longer had a fetal surgeon. So Texas was the closest one that he recommended. Um, so I got a call from them that day. We set it up for me to go out the following Monday, which is like a Tuesday or Wednesday. So my mom and I drove down there over the weekend. My husband, it was kind of comforting to know he was taking care of things at home, like taking care of the dogs and my stepdaughter and all that. So we decided my mom should come with me, and my mom's a nurse anyway. Um, so there was some of that medical comfort. Like if something were to go wrong, I had her with me, um, with her knowledge and stuff. And sometimes you just need your mom, I feel like. Um, so we got to Texas. We were staying right across the street from the hospital. The next morning, we walked across the street. I had the day like packed full of appointments. So the first thing was an ultrasound. They pulled me into a room with the MFM and his fellow that like they took care of my case. But they pulled me in after the ultrasound. And the MFM told me that there were essentially three potential options for intervention given a LUTO diagnosis. The first was the placement of a shunt to drain urine from the bladder to the sac in order for the baby to have amniotic fluid. Um, and the issue with that was that um, they didn't think my daughter, which I don't think I've said her name to this point, we named her Eden. Um, so they didn't think Eden would be a candidate because they could only find one kidney and it looked very dysplastic and like it was likely not functioning. Um, Second option would be to do a clinical trial of amniotic and fluid infusions, um, but they didn't offer it, and they said that not many places did. And since it was once a week, if I had to travel somewhere else for that, I would have to stay in whatever town for the duration of my pregnancy, and that just didn't feel like an option to me. Um, and then the last option was palliative care. They told me that since all of the remaining appointments I had were to determine her eligibility for the placement of a shunt, um, I didn't have to go through with them if I didn't want to because they were kind of hard on me. Um, I told them that I needed to know for sure whether or not she would be eligible. Um, so they sent me for an MRI right after that, which was uncomfortable laying on my back. Even though it was only 16 weeks, I had been staying off my back for my pregnancy just because I knew you weren't really supposed to. Um, so that was uncomfortable. It was uncomfortable because I couldn't move, and I do not like tight spaces. Um, and so then I had some other appointments with just like specialists to let me know what care would look like if she did survive. Um, and then at the end of the day, I had a bladder tap and a chorionic villus sampling done. A lot of people will get like the amniocentesis done, but I wasn't a candidate because she had oligohydramnios or low amniotic fluid. So they didn't think they would be able to get enough amniotic fluid to test it. Um, so they took a piece of my placenta instead. And both of those procedures were incredibly painful. They told me to prepare for just a pinch. It was some of the worst pain I'd ever had, and I think that's a pretty common experience for a lot of people who have those kind of procedures done. Um, it's the pain of like the needle through the uterus and then moving around. It's it's really hard to explain what the pain was like. It was almost like a really really bad period, except so much worse than that even portrays. So they ended up getting around 66 milliliters of fluid from her bladder, and then she needed to have some sort of bladder refill for her to be a candidate. Um, So I had some more appointments with like a fetal cardiologist the next day, and just a couple other appointments to check on things. An appointment with a genetic counselor was one of them. Um, Wednesday morning, we went back in and um, we did a repeat ultrasound. And like each ultrasound and testing that I had done was incredibly hard. I don't think that that's something that I was prepared for. It was very hard to look at her, knowing that there was such a real chance I might never get to meet her. Um, so it was very, very hard for me to actually look at what was going on. My mom was the primary one, like watching the ultrasounds through everything. Um, so on Wednesday, I went back. She had created about 20 milliliters of urine, which wasn't a lot, but it was some. They did find her left kidney, which they couldn't even find on the MRI. So that was kind of a crazy miracle that happened. Um, and then I finally got like the strength to look over at the ultrasound. And as soon as I did, she also turned her head and like looked right at the wand. Um, and she started moving her mouth, and I just started bawling. Um, I remember feeling that like that was like her asking me to fight for her. Um, and I'm super thankful to my stenographer because she did get a snapshot of that moment on the screen. So I have that for a memory. So then they said that they usually look for more bladder refill than she showed, but there was about a 10 to 20% chance that maybe the shunt would be successful. They told me to think it over. And then while I was getting ready to go, my nurse offered to make me a heartbeat bear that I could have just in case. I'm very thankful to her for that because I do still have that heartbeat bear. So I went back to the hotel, called my husband, we discussed. It was very hard because we didn't want her to be in any more pain or suffering than she might already be in. I didn't know exactly how much she could feel um, at 16, 17 weeks, but um, it was really hard because we also didn't want to put her through anymore, but we also didn't want to give up on her. So we ended up deciding to proceed, and they scheduled my surgery for the following day, which was a Thursday. Um, so I went in Thursday morning, went back to pre-op pretty quickly. Um, I signed all the consents. They got my IV, um, and then they started the cocktail of drugs to keep me calm. And I was then told that like the drugs and lidocaine were the only treatments I would be getting. Um, some of the consents had said some stuff about spinal or an epidural, but um, they didn't end up doing any of that, which talking to my care team later in my pregnancy, they thought that was insane because um, the hospital in Kansas City, they used to do fetal surgery and they would do a spinal for that, they said. So it was very painful. The surgery was. They had to add some amniotic fluid to be able to maneuver around, and that was fine. But then I could feel like the actual placement of the shunt with the trocar. Um, the anesthesiologist kind of held my hand as I cried, but that was about all they could do for me at that point. Thankfully, it was only about 10 minutes long, like the painful part. And then they took me up to post op. They kept me overnight for monitoring. About an hour after surgery, they had, the pulse ox, the toco monitor to look for any contractions, and then they were taking my blood pressure pretty frequently. But once they admitted me onto the floor, they weren't monitoring me at all with machines, anyways. So then about 1 in the morning, I woke up having to use the bathroom, and I felt kind of a gush of fluid. And so I ran to the bathroom and saw it was like tinged with blood, and immediately like broke down crying. And I called my nurse in between like sobs. Um, So she came in and tried to keep me calm, and she called the doctor. Had to wait about 30 minutes for the doctor, and doctor came in, did a bedside ultrasound. I wasn't contracting at all, and she said that there was still plenty of fluid, so it didn't look like a full break of my water. Um, and Eden was doing great. Her heart rate was fine. She was moving around. So they weren't too concerned with anything. So they gave me some Ambien to help me fall asleep. Um, the next morning, I had a repeat ultrasound just to see that everything was placed correctly. Um, and then the MFM came in and told me that everything looked to be placed well. She looked good. Um, and that the fluid that I had felt the night before was due to separation of membranes, which was caused by the surgery. He said that at about 17 to 18 weeks, those membranes start to fuse together. And since I wasn't quite 18 weeks, I was a couple days shy. There was a possibility they might fuse back together again. Um, and the bleeding and leaking would stop within a week. If not, I would have to deal with it for the rest of my pregnancy and just kind of keep an eye on signs of infection and everything. So after that, he discharged me. We went home. At 19 weeks, I had a follow up with my high risk doctor in Kansas City. He said she had oligohydramnios again, and that he's seen miracles. So we'll check again in a week and see what's going on. At 20 weeks, I went in, had another ultrasound, and then he did a cervical ultrasound as well. Um, he sat us down and told us that she now had anhydramnios, or no amniotic fluid. He said that from here on out, he would bring me back essentially to look to see if anything had changed, but also to check to see if my cervix was dilated or um, if I was getting effaced at all. Um, he then said if I made it to 26 weeks, he would refer my care to Children's Mercy up here in Kansas City. Um, and then he said one of the most gut wrenching things that had been said to me, especially up to that point, which was, but when you miscarry, you don't want to be stuck in a children's hospital, and your regular OB can handle that, which blows my mind how blunt and terrible bedside manner that is to
Yeah, that
just
is awful.
win. Yeah. And so I called my mom after that and I was super upset, um, because that's just a terrible way to phrase it. Um, and so she actually works at Children's Mercy in like their occupational health. So she's like kind of in their HR department. So she did some asking around, and she did find out that Children's Mercy was one of the hospitals that was doing amnio infusion clinical trials. So like immediately I was like, yep, please refer my care over now. I know you said 26 weeks, but I want it done now. Um, so at 21 weeks, I had my first appointment there, and the staff was so great. They were so kind. Their bedside manner was much, much better. They did an ultrasound, and the MFM came in and told me we could do palliative care or we could do the amnio infusions, because she was a candidate for that. He said if we were going to do that, we probably need to start that day because they usually start them at 20 weeks. So had I waited for that 26 weeks, I would have been way too far past when we could have started those. Um, so I went ahead and decided to do that. And I went in for appointments on Tuesdays and Thursdays. And Tuesdays were usually just to do the amnio infusion. And Fridays, sorry, it was Tuesdays and Fridays. Fridays, we would just check and make sure everything was good and see if we needed to do a top off of the fluid or anything. Um, so the plan was to do that through 28 to 32 weeks. Whenever my body seemed like it wasn't tolerating it as well, he said that he would recommend we stop. Um, and then we would wait to 38 weeks and schedule delivery then. Um, the infusions themselves were super easy. I expected them to be very painful because of the bladder tap and the CVS that I had done because it's a similar concept, you know, needle in through the abdomen into the uterus. But it was actually pretty painless for the most part. I mean, it was uncomfortable, but it was fairly painless. Um, and it was nice to see, like, as it was filling up on the ultrasound, and you could just tell she was relieved she had more room to move around. Um, so that was a really good experience. So I went in for my third infusion. It went great. She was playing with the needle as they were injecting the fluid. Um, she'd also pulled her shunt out, and we were watching her play with that on the ultrasound. Um, it wasn't functioning at that point because she wasn't creating any amniotic fluid, so um, that indicated pretty severe kidney damage. But yeah, we joked that it made a fun little toy for her in there. Um, and then that later that evening, I was just laying in bed on the phone with my dad and watching TV and stuff, and I felt a little bit like I peed myself, and so I got off the phone with him and went into the bathroom, and it was just a steady stream of pink fluid. And I knew it was a risk doing the amnio infusions, that it could break my water. So I called my mom and I told her, I'm pretty sure my water broke. I need you to come take me to the hospital. My husband was at work. And I called him, and he ended up being able to get off work and come out with us and go to the hospital. Um, so then I called triage at Children's Mercy, but because of my heart, I hadn't been cleared to deliver there yet. So they told me to go to one of the other local hospitals in the area, and we'll work on getting clearance done, and then they could transfer me over. So I went to a hospital not too far from where my house was at, and they confirmed my water broke. Um, they said that the next plan was to send me via EMS to the general hospital that's right next to Children's Mercy. That I think is called University Health now. I've always known it as Truman Medical Center. Um, so they transferred me there, and then the plan from there was to get an echocardiogram done of my heart and just make sure everything was good. And then they could wheel me across the little bridge that connected that hospital to Children's Mercy. Um, so that's what they did. When I was at Truman, I was hooked up to continuous monitoring. It was horrible, trying to keep a 23-week-old baby, or 23, yeah, 23-week-old baby on the monitor. That's very, very difficult to do. And so sleeping was awful. I'd have to press the call light anytime I needed to use the bathroom because they'd have to come unhook me. It's just not very fun. And then doctors were in and out of my room, and they pretty much told me that I had premature or preterm premature rupture of membranes, or PPROM. So most that have PPROM go into labor within 24 to 48 hours after their water breaks, with a max of being like a week after their water breaks. So they told me to expect for that, um, which was really sad because I was only 23 weeks along, and I knew that that wasn't far enough. Um, so they started antibiotics. I got steroid shots to help develop her lungs. I ended up getting that echo done, and they said my heart looked fine. So they got me transferred over to Children's Mercy. Um, and I'd gone in on a Tuesday, so this was a Thursday by the time I got to Children's Mercy, October 11th, um, or sorry, October 12th. And I remember just being so relieved to be at Children's Mercy because that's where I wanted to be, and I just felt like my care was really good so far that I'd had there. Um, so I got into my room, and my nurse told me that I needed to do 8 hours of continuous monitoring, but if everything looked good, I could come off. And she asked me if I wanted to shower and put on my own clothes, and that was one of the most relieving things that anybody could have said to me at that point because I was so tired of being in a hospital gown. Um, so I decided to do my monitoring before showering and changing and all that. But um, after the monitoring, they said everything looked good. And the MFMs came in and they told me that since my PPROM was caused by a sterile medical procedure with the amnio infusion, that it was more likely than other people who have PPROM that I would make it up through term. Um, they did confirm I needed to be at the hospital until I delivered to watch for infection, just and do NSTs every so often to make sure she was doing okay. Um, so I kind of knew at that point that I was going to be there for a while. Um, so that night, my husband came up and I had him bring my pregnancy pillow. My mom brought a fire stick, and they both brought me some clothes. Um, and then I ended up being able to work the entire time I was in the hospital, which was fantastic. Um, I work from home primarily now, anyways, um, but it was really great to be able to do that and keep my mind on something else and to have a routine to get me through the days. Um, so I ended up spending a total of 99 days in the hospital. 97 of those were at Children's Mercy, which I broke their record. I think their record before that for antepartum moms was 71 days. So I was there quite a while. I got to know everybody really well. Um, the OBs were great. There were two hospitalist OBs, and then they had contract OBs that would come in for like the weekend shifts and stuff. Um, and my nurses, like, I cannot say enough good things about my nurses. Um, they really became a huge support system for me, and they were some of Eden's biggest cheerleaders. And they almost became like family. It's kind of weird to say, like, I actually miss being around them every day a lot of the time, um, just because I got so used to it. Um, so, and I really do hope that they listen to this one day and kind of know what impact they made, because they really did. Just, I cannot say enough good things about the care I received there. Um, so yeah, it was pretty boring most of the time I was there. I did for a while, it was 3 hours off of the monitors and 1 hour on while I was awake. Um, and then eventually we switched to just being monitored 3 times a day. I could always be monitored more if I felt like something was wrong, or if I was worried, or if I woke up in the middle of the night and I couldn't get her to move. And I just needed to know she was okay. They were always willing to put me on as much as I wanted to be on. Um, but I got into a real good routine. But those 99 days did include Thanksgiving and Christmas. I actually remember in like mid October watching, I don't even remember what show I was watching at that point, but there was an episode, and in the background it had I'll Be Home for Christmas playing. And I remember crying just thinking about the fact that I won't be home for Christmas this year. Um, my mom did end up making both really special for me. Um, she brought up my family on Thanksgiving, which was nice because my husband was sick and was supposed to have come up, um, but he didn't want to risk getting me sick. So he stayed home. So she made it really nice. And then Christmas, she coordinated it with my in laws, for my family and my in laws to come up, and my stepdaughter. So we did gifts and we had a Christmas dinner, and it was still really nice, even though I was stuck at the hospital. Um, my mom came to visit several times a week because she worked there. So she was up in my room a lot. She brought me a lot of food so I didn't have to eat hospital food, which I was very grateful for. My husband came up about once a week, um, just between taking care of our dogs and my stepdaughter and work. That's what we worked out. And I was fine with that. It sucked. But again, it was one of those things that, like, I was so stressed about not having control of anything that it was nice to know he was handling things at home. Um, And then my parents and sometimes my husband would bring up my dogs every Sunday in the parking garage so that I could go sit out and be with them for a little over an hour, um, because that was really hard being away from them. Um, so, like I said, it was pretty uneventful during my time. I had some prodromal labor that started the day after Christmas, but didn't end up progressing anywhere. And I had that all the way up through my scheduled C-section. So we scheduled the C-section for January 15th, and we chose C-section because we didn't know how she was going to tolerate labor, and also because of all the problems with her kidneys and all the cysts that were all over her kidneys. Her belly was measuring like 7 weeks ahead. So at 36 weeks, I was measuring at about 42 weeks for her belly. And so we were scared she'd get stuck. Um, so we went ahead with the ultrasound, um, or not the ultrasound, sorry, the C section. Um, because of the circumstances, though, one of my nurses got it approved where my mom could be in the resuscitation room with Eden after she was born, and my husband could stay with me in the OR. We knew, Eden's life might be short, and also my husband's very, very squeamish, so we were very worried about him having to maneuver around me to get out of the room. Um, so yeah, we decided that that would be best. So my mom actually got to watch my C-section happen on the screen in the resuscitation room, um, which I she thought it was cool. That kind of grosses me out a little bit. I'm not gonna lie. So Eden was born at 8:16 a.m. and she like gave a really loud cry when she was born. Um, my husband and I burst into tears because we didn't think we would get to hear that cry, um, because we knew her lungs were likely underdeveloped. And um, so they took her over to the resuscitation room. My mom said that the NICU doctor in there was great and would explain like everything that they were doing for Eden, everything that they were seeing. Um, After she saw Eden's X-rays, though, she knew something was wrong. That's not really her area of nursing, so she didn't know exactly what was wrong, but she knew it didn't look right. So she ended up coming to my room where I was recovering because she didn't want to know anything before I did. Um, and the NICU doctor had been in a couple times to talk to me at that point, and I was just kind of on like a hope high, I'll call it. Like, just okay, well, she cried, so maybe things will be okay. So I don't know that I fully understood all of the updates she was giving me, um, until she came in and let us know that she was on the highest vent at the highest setting, and her lungs were struggling and she was in a lot of distress. Um, and the way she phrased it really still sticks with me. And it was important for me to hear it this way in the hospital. But she said that Eden is showing us signs that her lungs are not strong enough to survive, um, which really just kind of reminded me that at the end of the day, it is her body calling the shots. It's not the doctors, it's not me. We didn't have control over what her body was doing. Um, and with the care, like Children's Mercy's got a super great reputation in the area too. Like, I knew that they had done everything for her. And if they tried anything further, I was scared that it would put her through a lot of unnecessary pain. So um, they also confirmed that she had a cloacal anomaly or cloacal malformation, I've also heard it called. Um, so that was the cause of her LUTO. And cloacal is essentially a condition in which the genitourinary and digestive waste tracts don't fully form. So she didn't have a urethra, a vaginal canal, or an anus. Um, so she had no way for to excrete the fluids that they were giving her or to pass gas. Um, so that was really sad to hear. But they told her that they would bring her, or told me that they would bring her to me for the rest of her short life. They said we might have 15 to 30 minutes before she passed. So my husband and I talked and decided that we wanted to make sure that all of Eden's grandparents got to meet her. But we wanted to spend most of the time primarily just us. So um, we said that the grandparents could come in for a couple minutes and get to see their granddaughter. So my mom went out to the lobby and she delivered the news to everyone that was there. Um, and my stepdaughter thankfully wasn't there when my mom delivered the news. But my mother in law ended up being the one to have to tell her. And I'm so grateful we didn't have to do it, but I can't imagine how difficult that was for my mother in law. Um, and I guess my stepdaughter's response in that moment was just start crying and yelling that I need to see Sydney, I need to see Sydney, which just breaks my heart. Um, that she was so worried about me in that moment, not herself. Um, it's kind of how she is. She's very, very empathetic to everybody else. So um, they brought Eden to my husband and I at about 11:30 a.m. and they hooked her up to the monitors in my room so that we could have some privacy and they could monitor her from the nurse's station. And then as soon as they put her on me for skin to skin, her SATs just evened out and she stopped showing severe signs of distress. And like the nurses were all incredibly shocked because they really did think we would only have 15 to 30 minutes with her because she was just in that much distress. Um, so our parents were able to come in and meet her. And then a few minutes later, they left. My husband and I just started talking to her, telling her how proud we were of her. Of course, in my head, I was begging and pleading with God not to take her and to heal her instead. Um, but after about an hour, she was still doing very well for her present condition. Um, and it became kind of clear that she was hanging on for a while. So we invited anybody that was there into the room to meet her if they wanted to. Um, and we decided to let my stepdaughter meet her to make her real in my stepdaughter's head. Thought it would be more traumatic for my stepdaughter to not get to meet her than it would for her to actually get to meet her. So my brother and sister were both there, and my brother's girlfriend and one of my best friends. Um, so they all came in and met her. My stepdaughter got to come in and meet her for a little bit. Our parents were in and out for a little bit, so it was nice to kind of have family around for a little bit. Um, and after about 30 minutes of this, we decided we just wanted to have some more alone time with her. So we started listening to my playlist of like Christian music because we knew she was going to heaven soon. Um, so we wanted her to learn a little bit. I know it's kind of silly because she's a baby, but we wanted to communicate that she was going to a good place. Um, and so my husband also started reading some from Psalms to her. Um, we just talked to her a lot. We told her that we were very, very proud of how hard she fought, but she could let go whenever she felt like the time was right. So about 4:45 p.m., she was still hanging on really well, which was over 4 hours longer than they thought we would have with her. So the palliative care team came in and suggested that we extubate since she didn't have an outlet for those fluids. It could start to get uncomfortable for her if we let it go on too terribly long. And we didn't want that. So we decided to go ahead and extubate her. Um, so after she was extubated, we just kept doing what we were doing, singing to her, talking to her. Her nurses kept coming to check on her. Her heartbeat was still going strong. She was still breathing. I noticed her hands getting purple, so I knew that she wasn't getting good oxygenated air. Um, but she was still breathing, still hanging on. They did tell us that it could drag on for a while to be prepared for that. So a few hours later, at about 6:30, my nurses came in the room and said that, typically after C-section, recovery would dictate that they get me up and moving, and I'm using the bathroom by myself and all that by this point in the day. Um, they had left my catheter in so that I didn't have to worry about getting up and going to the bathroom or anything like that. Um, so they asked if they could just get me up and they could leave my catheter in, but just maybe change me into the one of the birthing gowns that I'd bought, like just get me up off my feet for a few minutes, to get the blood flowing better. And so I said, okay. And up to this point, my husband and I had decided that I would just hold her. I was happy if he wanted to, but he wanted to let me have that time with her. Um, he thought that would be important to both me and her in the long run. But since I was getting up, I asked if he'd hold her, and he said, of course. And so he got to hold her and love on her. And the nurse came in and checked on her while I was getting my gown changed in the bathroom. And her heartbeat was still going really strong. And he told my husband that she'd really surprised them all with how strong she'd been all day, um, which is kind of cool to hear, even though, we knew it wouldn't last forever. It was really nice to hear that. Um, so they got me back in bed and they laid Eden back on my chest, and my nurses left the room. And about a minute later, I heard her take a really big inhale and then exhale really loud. And I just kind of knew at that point she was gone. Um, I looked at her hands and they were white instead of purple. Um, and so I knew she was gone. And so I told my husband to go get the doctor, um, because they needed to come in and check, make sure I was right. And so they pronounced her dead at 7:10. And her death certificate actually lists four causes of death: lung hypoplasia, the LUTO, multiple congenital anomalies, and an imperforate anus, and then cardiorespiratory failure. Um, so after that, I sat with her for a while, just kind of holding her. I don't really remember much of the night because I just remember just being numb, but I don't remember like events. I don't remember what caused me to tell my nurse it was time to take her. I don't really remember any of that. Um, so at some point they took my catheter out and probably gave me something to help me sleep. Um, I woke up at about 3 a.m. having to use the restroom. So I went in, used the bathroom, came out, got back in bed, and then I went to put my hands on my stomach to feel her move before I fell asleep, like I had done every night for the past 99 days. And and then I realized she wasn't in there, and I broke down, and my husband had to come comfort me because I was almost just screaming. I'm actually really surprised none of the nurses ran in. um, so I ended up asking to be discharged a day early because I just didn't want to be there anymore. Um, so I mean, they really worked with me. They were fantastic. The nurse I had for Eden's birth and then the 2 days following, she was so great because she just treated me like a normal patient, um, which I can't explain what that meant to me. Like, not to see a ton of pity, to see empathy, but not pity, and just feel normal a little bit. Um, all of my nurses were, of course, great, but it was kind of a blessing that I had her those 3 days. Um, and then they did a ton of crafts and molds and footprints and handprints and all these different mementos for me to take home. There was a camera that they had taken a ton of pictures on throughout the day, and just kept taking pictures of her and posing her for different pictures. And they sent me home with the SD card with all of that on it. So I'm very thankful to them for doing all that, so that I have all that to hold on to. And then we had the funeral like a week later, and just to quickly touch on it, everybody was just so great. With between pricing, but also just like compassion, between our guests, the graveyard, the um, funeral home, all of it. Uh, I don't think that many knew exactly how to act, but I think everybody just showed such kindness that it was fantastic. So sorry that was very long, but that's my story.
No, that's definitely a long journey that you went through, but you did everything that you possibly could have done for her.
Yeah, and that's something that's comforting to know. Um, at one point before my C-section, I had asked if we were going to do an extra dose of the steroid to help her lungs, and one of the doctors came in and she told me, she said, "We don't know if it would help. We don't think it would hurt. At this point, you have done so much to fight for her that if you want to do it, let's go do it. Let's do it." Um, so it is one of those things that's very comforting to know, as hard as everything is, that we did everything we could.
And what a difference, that doctor from the one who just said, when you miscarry,
Oh,
like,
I know.
like what a difference.
It it was remarkable how great the staff at Children's Mercy were. And I mean, even it's kind of a only about 250 women deliver there a year. Um, and obviously, if you're delivering there, your baby has some kind of diagnosis. Um, but my best friend actually just ended up there, and she just delivered her baby there, and so I got to go up and visit and see some of my nurses. So that was kind of nice. But like, I truly do miss being able to see them a lot because they were just so kind and personable
Yeah,
and
you
such
feel
great
that bond
care.
with them.
Yeah, and I'm so thankful that I hear so many people's stories, and there was a lot of trauma around their birth, and it breaks my heart. And there's a lot of trauma in my story, but none of it surrounds my birth, and so that just is a huge blessing.
Did you find it hard having such a rare diagnosis? I mean, had you ever heard of it before? Did you know anybody else who's had it?
No, so actually no, I had didn't know anybody else until I made a connection. So very early in my pregnancy, I had talked with one of my former coworkers. She works at the bank I still bank at, so I had seen her, and after one of my appointments, and kind of broke down crying. um, so I was talking with her, and she was like, "Well, 22 years ago, my sister gave birth to a baby that didn't have, she put it a little bit more crass, but her genitourinary tracts didn't form." And so after Eden was born and had that confirmed diagnosis, it was funny because I was like, I actually do know somebody else who has this. But the combination of everything, I mean, between the LUTO and the cloacal alone, it's pretty rare. I want to say cloacal is like 1 in 20,000 or 1 in 25,000 for to happen. And then LUTO is about 1 in 5,000, but those stats are for boys. There's a lot of boys with LUTO, but you don't see very many girls that have it. Um, so no, I hadn't met anybody. And then on top of that, I had the P prom. So it was very, very hard, going through like just a series of events that were just so rare. Like I could find a support group for any one of those things, but to find one for somebody that has had all three happen was like almost unheard of. Um, and that was one of the reasons we were very, very adamant about posting updates online, like on my Facebook and stuff, because I wanted it, and they're public. My account is private for the most part, but all of those are public because I want somebody to be able to search some of those keywords and find somebody that maybe isn't having the same experience, but that also had such like a rare series of events happen, because it is really isolating.
Yeah, Jasmine had a pretty rare diagnosis. She had mosaic trisomy 15, and I posted about it a few times. And even like, it was like 2 or 3 years later, I had somebody like, I saw your post. I'm reaching out because now my baby has this. And so, like, that even years later, like, people can still find it.
Yeah, that's that's really awesome to hear and encouraging because I hope that that happens. I mean, I don't hope that that happens. Let's put that first and foremost. I really don't hope that that doesn't happen. I don't want anybody else to have to go through this, but if it can help somebody, that kind of brings light to such a terrible situation, you know?
Right. Did they tell you if they thought it was something genetic or if it was just a random occurrence?
So all of the genetic tests we had done didn't show anything genetic. So they offered to run like one additional test and take, my DNA, Eden's DNA, and my husband's DNA. Um, they weren't really sure that they would find anything, and my husband and I. This was after she passed. My husband and I didn't really see a point in doing that because the most that would happen out of that was it would maybe scare us away from trying again. Um, but they weren't really confident they would find anything because all of Eden's genetic tests came back and they think it was just like a fluke that happened in her DNA structure,
That's kind of
which,
similar to what happened with us, and kind of the same thing with the genetic test. They said it seemed to be just a random occurrence, and I remember the genetic counselor saying, "We could run this test on you, but what if we find something else? Would that scare you from trying again?"
yeah. Yeah. And I mean, it's a very real like, I'm sure, I haven't, this was all, I had her in January. So it's all pretty recent. So I haven't had another baby yet. I haven't had my rainbow baby, but as I'm sure like the next pregnancy I know is going to be already anxiety filled. I don't need to add anything else to it.
Yeah, sometimes knowledge is great, and sometimes it's better to just not know things.
Right. Exactly. I would agree wholeheartedly with that.
So I feel like sometimes we know a little too much.
Yeah. Well, and that's the thing. You think of like way back in the day, they didn't know any of this. It's crazy. At least now we can know these things and be prepared ahead of time. But it's one of those, at what point is it going to interfere with my life and my choices too much?
Right.
So,
So, is there anything else that you would like to share or add?
um, I mean, just some things that have helped me, just maybe going forward can help somebody else. A big thing has been actually listening to your podcast and hearing other people's stories. They're not the same as mine, but it's very validating to hear a lot of the same emotions wrapped up in their situations. And just, it's very, very validating and helps me process a lot of what I'm going through. Um, and then therapy has helped a lot. I know therapy is not for everyone, but I made myself start going very, very quickly after the funeral because I knew I had a lot to work through, and I knew if I kept putting it off, I'd probably never go. Um, and then just really just talking about my story in Eden, like it's helpful to know that maybe it could help impact somebody someday. Um, I really try to look for the beauty in the situation. In such an ugly situation, there were a lot of really big moments of beauty, from being able to have that time with her, that 11 hours. My husband and I, we really don't think that she was ever meant to be born initially. Like, I think that all the forces were working against her being born, but everything we did, um, we did get a miracle, even though it wasn't the miracle we wanted, in getting to meet her and have that time with her. Um, so keeping her alive and being a mom to her in that way, but also just being able to find those moments. moments of beauty.
Well, I want to thank you so much for coming on today and sharing your story with us.
Yeah, thank you. Thank you for giving me a place to keep doing that, to keep talking about her.
Thank you so much, Sydney, for sharing your story with us. Again, I'm just honestly amazed at just how much you did to give Eden the best chance you could. I felt the same way with Jasmine and tried everything I could to save her. In the end, despite taking every single measure we could have possibly taken, I know it sometimes feels like we never did enough. And I think that's just the mom guilt that's in us. It brings us back to all the what ifs and questions we have. Because when you lose your baby, it just never feels like enough. Not enough time, not enough answers, not enough of anything. Even if you have answers for why it happened, we always questioned why it happened to us specifically. I mean, these questions can just be endless. And I think it's just a normal part of the grieving process that we go through. Did you feel this same way? Are you the type to question everything, or do you just accept things as they are? Don't forget to subscribe so you don't miss any future episodes. If you like the show, please leave a review or rating on Apple or Spotify. It only takes a moment and really helps the show reach more loss and infertility families. Thank you so much for tuning in, and remember, we are all in this together.